My name is Tim Maria, host of Digital Health Live. We're down here at Santa Clara Convention Center, which I've been to many times in the past, the demo conference, Startup America, at the HealthTech conference today, and I'm super excited to meet an entrepreneur, founder, and an investor, and a teacher working in entrepreneurship, Chris Kuenne with Rosemark. Hi.
Hi, how are you? It's great to be here, and thanks for the opportunity to chat a little bit.
So what's really cool about doing these events is you never know who you run into. And I remember being a kid, and you guys all probably remember wearing Band-Aids, and then they started adding brands to Band-Aids, and you're the guy that created that, or you're one of the team.
I was fortunate enough to be on the Band-Aid brand back in the early 90s when we figured out that what kids really did with Band-Aids was to wear them as decorations. And so I brought Big Bird to a Band-Aid.
Wow. I think I had one of those. So, because I used to get hurt a lot as a skater and as a pretty aggressive athlete as a kid. So you have a background not in the medical space as much as in the branding space, or what is your story?
I started my marketing career at Johnson & Johnson in brand management, first in Band-Aid and then on the Tylenol brand, and got really interested in why consumers behave the way they do, which ultimately led me to start my own company called Rosetta, which is one of the largest digital marketing agencies.
And that's really interesting because consumer behavior is rapidly changing with these new waves of social media services, mobility, and things like that.
Right. Yeah, it's incredible, the data, the clickstream, and the insights that you can get about consumer choice now in the connected world. And we were fortunate enough to build Rosetta at a time when all this data was converging and personalization became so important.
So what was the topic today, Chris, and you flew in here from where to speak?
Yeah, came in from Princeton and bleary-eyed last night. And the topic was actually with two of my portfolio companies and one other person, and we were talking about the role that personalization will play in realizing the dream of health tech. The products are extraordinary, the opportunity amazing, but health tech will really take off when we really nail personalization. So we were talking about techniques to bring personalization to health tech. In fact, my opening slide was a picture of Copernicus's revolution, and really where the center of the universe is no longer the doctor or the insurance company, but the consumer.
And we're seeing that drive dollars. People are actually spending their own money using services. We're just learning about a digital mental health company that was consumer-based, and that also drives how do startups think about business models. So what else was coming out in the conversation? What companies were on stage with you?
Yeah, so Doctor on Demand, one of our portfolio companies run by a terrific leader, Adam Jackson, and Derek Newell's Jif were also on the panel. And what's fascinating about both these solutions is they are bringing the magic of digital and the scale of what mobile and digital can do, and yet personalizing the experience to enhance ultimately consumer health. And that's what's so exciting about where we are, I think, in health tech in general.
Break down what Jif does and what Dr. Demand does for those who don't know.
Yep. So Fortune 500 companies and other self-insured employers spend almost $500 per year on each of their employees to actually bring health and wellness programs. One of the challenges is that nobody knows really which programs work and for whom. And so Derek and his team have built a platform that allows a Fortune 500 company like Johnson & Johnson, for instance, to put all of their health and wellness apps and programs on a single platform and then being able to study which ones work with which consumers. And Derek did a great job today talking about the fact that there are lots of great weight loss programs. For some people, it's Jenny Craig. For some others, it could be Weight Watchers. So connecting the right person to the right program can have a significant improvement in outcome.
They also, I think Jif was also working across wearable health trackers and things like that and building programs in so you can pair censored data with reward systems?
Yeah, that's exactly right. For instance, Fitbit has a program with, say, Johnson & Johnson where J&J will pay for your Fitbit if you agree to wear it and walk 10,000 steps. So that data gets uploaded onto the Jif platform and is used to further optimize the health and wellness programs for that employee and then ultimately for that company. The other gentleman who was on the panel with me was Adam Jackson, who is just a total dynamo, reinventing the way acute care is delivered over your smartphone. His company, Doctor on Demand, I think is really going to completely revolutionize the way particularly working women think about how to take care of their kids when they're running off to the office. They're trying to figure out whether the child has strep throat or a fever. And Adam and his team have developed a terrific product to address that issue.
Yeah, we had Adam on stage, and I was down at their booth at CES last year. They made some big announcements. Where are they at today compared to 6 months ago or 8 months ago?
Yeah, it's remarkable. Adam is building out the number of employees on his platform. I think there'll be more than 5 million employees who can actually use Doctor on Demand, and he's continuing to activate all of those folks. So it's both insurance companies and private pay self-insured employers who sign up for Doctor on Demand, making this wonderful service available to their employees or their members.
Now, this is the entrepreneur question, so I'm going to switch hats, and now you're going to put your investor hat on. And I see Jack Young, who's a VC, do help fund Fitbit actually. And so I'm curious, how are you helping entrepreneurs, and what are some pro tips you can give them to enter this space?
So entrepreneurship starts with the fundamental question of product market fit. And so there are many, many examples of health tech companies that have mastered or achieved a certain level of product market fit. And then the next part of the game starts, and that's where we specialize. After product market fit is established, how do you actually engage the consumer, and how do you go from 1x to 1,000x to 1,000,000x consumers on your platform? And so there will be lots and lots of wonderful ideas that actually never make it because they didn't actually cross the chasm to consumer adoption, measured in hundreds of thousands to millions to tens of millions. And that's the specialty that we're most interested in from an intellectual standpoint, and where we think we can team with management to have the biggest impact.
So that kind of centers around the Copernican shift, because now the consumer has the power. Mobile devices are at global scale. They're a multimedia Star Trek communicator basically hooked up to a cloud system. And so you got to know consumer marketing, which is a different game than that's been in the DNA for the healthcare industry typically.
That's exactly right. I think the constraint early on was product, exquisite user experience. There are lots and lots of great solutions that meet those two criteria. The next major threshold is consumer engagement. And it's going to be a race to consumer engagement because there'll be just a finite number of applications or solutions that actually end up winning. I mean, take for instance, social media platforms. There were thousands of them. Now there's one. Take search engines. There were thousands of them. Now there are 3. So there is a very quick evolution from great product market fit to critical mass to owning the shelf, so to speak, with the consumer.
So companies can approach you, they can pitch you. How do they do that?
Yeah, so we only make a couple of investments each year. We're very selective in choosing management teams who have a great product, who are past the product market fit stage, and really are committed toward building out personalized marketing. And in those situations, we think we can be quite helpful. We've been gratified by the fact that there are lots and lots of companies that meet that criteria, and so it's really a matching process of where we could be most helpful.
Okay, now this is the last question is, I'm seeing a lot of interesting technology kind of repercolate up, like virtual reality and augmented reality, and that's tied to this mobile experience. CES is coming up. We're going to see a whole bunch of product announced. What's in your crystal ball that you see that's kind of a hot space that's going to be real?
Yeah, that's really tough. It's a great question, and I wish I were such a good prognosticator. And we specialize really in the question of how do we take what's real and then activate it. So I'm not sure I'm really the right guy to answer that question.
Let's go into your book. You have a book.
Yes. So we're taking this whole idea of you and I are fundamentally different, and different in a way that we can understand, and create personalized marketing. For health tech, we also have found that entrepreneurs are fundamentally different from one another. And my co-author, John Danner, and I are working on a book in which we've been able to prove that there are actually only 4 personalities of entrepreneurs. And in fact, the way each of those personalities then makes the big decisions about what customers, what employees, what investors, and then scaling the business is profoundly different. And so we're very close to signing a publisher and look forward to bringing this book out in 2016.
So is there like a Myers-Briggs test for entrepreneurs then?
There is indeed. In 10 questions, we can describe very accurately. So Mark Cuban and you might be the same personality. I'm kind of sensing that you are. In fact, we get the chance to interview Mark Cuban next week.
How cool. He put some money into a friend's company. He's a very interesting guy. And well, that's all super fascinating, Chris. Excited to see what happens with the book. Love to be you can quiz me or whatnot.
Absolutely, you could be in.
And well, very exciting. Thanks for being down here at the HealthTech Summit.
Great. Well, thank you so much. This has been a great, great conference. The right people, the right context, just terrific conversations.
All right, Chris with Rosemark. And do we go over how people can link up with you?
Yeah, so you can reach me at rosemark.com. So that's just chris.keeney, K-U